At Turimiquire, the people we serve drive our programs. It is our mission to facilitate capacity building and empowerment to all of our stakeholders in the most essential areas of their lives. From our rural roots in the Rio Brito watershed throughout the communities along the river and down to our urban base in the Caribbean coast, our work supports human service, education, and environmental and animal welfare projects.
My name is Robert Albert, known locally as Bob Albert, and more locally as Jose Mango, here on the Brito. And have been living in this valley for 27 years.
The carpentry program focuses on providing skills, access to materials, and tools for building. Milled boards are made from already fallen trees and used in furniture-making workshops, home construction, and enterprise.
We produce a lot of cashews. It's becoming more and more of the economic base for this community. There's an oil, a caustic oil in the shell, which actually has a lot of industrial uses. And it would be good to figure out how to extract it and get that much more out of the production of the valley.
The Foundation's micro-lending program in the Brito Valley mostly deals with food production. The mainstay for people here, both to eat and to sell, is a bread called casabe. It's made from a root vegetable called yuca, which is ground into flour and baked over adobe ovens. The Foundation also lends small amounts of seed money to help local women sell empanadas and sweets at community events. Other products that we support include honey, cashews, bamboo necklaces, and fruit preserves. Recently, the Turimiquire Foundation conducted a survey among Brito residents asking them to identify their most pressing health concerns. Time and time again, the reply was intestinal parasites. Contaminated drinking water and poor hygiene are the #1 source of illness in the valley, and because of this, the Foundation turned their focus to clean water.
And a couple of houses got together, put in a long hose to their house. Then the neighbors started seeing that they no longer had to wash in the river, they no longer had to haul any water they used for cooking, drinking, washing, all the way from the river on their heads.
In 2006, with a government grant, the Foundation installed gravity-piped potable spring water into more than 100 homes. Modest wages were paid to locals who worked to install the systems themselves. Animals are supported by the Foundation in a number of ways, including vaccination of pack animals, control of vampire bat populations, and supplemental food for undernourished animals.
My name is Randy Bledsoe. I am a resident of Venezuela. I lived in Venezuela for over 10 years. I've spent probably 2 years of my life living in this river valley.
The Foundation believes that education is the key to Venezuela's future. Educational activities are supported from kindergarten to elementary school, all the way up to high school and even college. For students who live in the remote Brito Valley, education after the 6th grade was almost impossible until recently, and even now entails hiking long distances to the road to wait for often unreliable public transport to take them to the nearest high school. The Foundation's scholarship program sponsors over 40 low-income students who, for just $200 each per year, can continue their studies. Scholarship funding supports transportation, uniforms, shoes, books, and tutoring. Because school textbooks are too expensive for individual families to buy, the Foundation was asked to start a library so that the textbooks could be shared amongst students in the community. The Foundation was also asked to help with school supplies to support all of the other educational activities being provided. So, they buy supplies in bulk and sell them at very minimal prices at a rural school supply center. Another educational activity provided by the Foundation is called the Digital Divide Program. In this program, students are provided both access to and education about computers so that they can be connected with the global community.
My name is Stephen Blumstein. I'm president of the Turimiquire Foundation. I think we actually have, for people who would be interested, a fairly replicable model of how you can deliver at least family planning and reproductive health services in third world countries using their own resources. We really try to follow what the community here wants and how they would like to go about solving problems in this particular area.
The Foundation sponsors medical visits and general health services while maintaining their roots in women's health and family planning. Family planning is a stated policy of the Venezuelan government, but the nation has simply not been able to keep up with the tremendous demand for this critical and elective service. In a country whose population has more than tripled over the past 50 years, the unmet need for family planning remains enormous.
Within 2 or 3 years of starting the family planning program, women immediately came to us asking for help with educating their children.
The Turimiquire Foundation has spearheaded the reestablishment of family planning services in the state of Sucre. Since 1997, they have supported family planning and programs in public hospitals, private clinics, and selected rural health clinics. They supply contraceptives, educational materials, staff and administrative support for family planning services and reproductive health workshops. All of the services are implemented by Venezuelan healthcare workers in accordance with the Venezuelan public health policy. My name is Lindsey Bloom, and I have had the privilege of working with the Turimiquire Foundation and the Rio Brito community over the last 6 years as a volunteer and an intern. One of the best memories from the community center was one day when we just brought it all together under one roof. We had theater presentations, food, mask making, arts and crafts, face painting, and then on top of that, there were volunteer doctors doing examinations, providing vaccinations, tuberculosis testing, and there was even a mobile dental clinic parked across the river for all the kids.
And I was very surprised at how receptive everybody was. This part of Venezuela is not well known for small private foundations. We may be the only one in Cumaná, but people understood very quickly what the idea was and how to go about it.
It's really been amazing working down here to see how much can be done with so little. At the Turimiquire Foundation, 94 cents out of every dollar goes directly into our services. There's very little overhead or administrative costs at all for what we do. The vision at Turimiquire is that more and more people build their own capacity to improve the conditions of their lives so that the hopes and dreams they have for themselves and their children can be realized. In the developing world, just a little bit of resources can be stretched very far. For just $250, a scholarship can be given to support one student in high school for an entire year. For $500, long-term contraception can be provided for 30 women. And for $1,000, we can install new bathrooms in the community center.
We decided that we had to do more, and that we could do more, and that we should do more.